Hey guys, it has been such a chill beginning of the year. I started with this course called Evidence-Based Medicine. Like, the course is easy, but the concept is actually quite difficult. So the principle is, if you have a patient and you're not sure about how to manage them, you're supposed to try to find some sort of research article that involves like different treatment arms or like studies their pathology and see if you can apply that study findings to that patient. I think the idea of it is easy because for this course we just had to pick out a handful of articles to read and then report on it. And it was actually quite nice because I've had some random questions come up that I felt like weren't answered, but it is very hard finding a research article that specifically matches the patient in question, because I think the reason why that there's a question about that patient and their treatment is because it's rare, and so it's hard to find, like, you know, trials that match that patient demographic. But it was a nice chill month to just do an easy course because I was finishing up with residency interviews, and next month I'll be doing trauma surgery, and it's going to be probably intense as far as hours go. Happy Sunday! So today is my day off. I'm currently on my trauma rotation, and I just went to church this morning, did some groceries, and I put together a quick little lunch. I already mixed it up, but it has some kimchi, eggs, some salmon, carrots, and cucumbers, but it smells really good and I'm so excited. So I just wanted to share with you guys what a day in the life of trauma looked like. So normally I would wake up at about 4 a.m. and I would read my daily devotional, and then after that I would head downstairs, brew some coffee, get ready in the bathroom and brush my teeth and stuff. Then I would put coffee in my to-go mug and bring that to the hospital, and at the hospital I would usually get there around 5, and that's when I would work with the residents and other med students to prepare the list, which is just basically pulling labs and vitals for each patient and writing them down on a piece of paper so that we'll have them ready for rounds. Then I would go and check on 2 patients in the ICU, basically see what drips they're on and how they're doing mental status wise. After that, around 7 a.m. the attendings would come in and we would do table rounds, which is when the residents present to the attendings about all of the patients that they saw in the morning. I only had to see 2 patients a day, but the residents each had to see about 20. During table rounds is pretty much when we try to identify which patients we should be worried about and come up with a general idea of what some plans could be. But then after table rounds we would do walking rounds with the attendings, so we would split up between the ICU and the floor. I was mostly in the ICU, so I would present my patients in a system-based format, propose plans that were sometimes accepted and sometimes rejected, sometimes not heard at all. Rounds would normally take 2 to 3 hours just because we had to approach each patient very thoroughly to make sure we're not missing anything in the critical care setting. And after that we would just go see consults and help out with traumas. Our responsibilities in trauma is basically to help take clothes off so that we make sure that we're able to identify all of the patient's injuries. We also want to remove any source of exposure to further injuries. And then I would also do some of the fast exams. I actually really enjoyed seeing acute care surgery consult. There was a lot of like gallbladder consults and appendicitis consult, common diseases that general surgeons help manage. As far as how busy the day was, it kind of depended on how many traumas came in and how many consults they were. I think the busiest day I saw, there were 3 trauma activations, 11 consults, and it was just a very hectic day. If it was a slower day, I would just read up a little bit. I read both the trauma chapter of Sabiston's, which is a surgery textbook, and I also read the surgical critical care chapter because I was in the ICU. And then other things I did during downtime was practice some of my knot tying, and then I would also talk to the M3 students who are with me on the service, and we would just talk about common diseases that you see in general surgery. We also talked about the primary survey of trauma. Usually leave at around 6 p.m. p.m. There were a couple times when I stayed late if there was a trauma activation that came in the middle of shift change, or there was a fun case that I really wanted to stay for. But I did my best to leave at around 6, and then I would come home, eat dinner, and then watch like a K-drama to wind down before going to bed at around 9 or 9:30 to get up and do it all again the next day at 4 a.m. Got this coffee from a program actually that I interviewed at, and so I'm gonna drink this because we ran out of our regular coffee. So I just had some breakfast and talked to my younger sister today, but now I am ready. Alright, just got out of church and now it's time to go to Costco. TTE. It's been so long since I had a chicken bake, and I used to have these all the time when I was a kid. I just got home from running errands. I ended up getting my car washed because it looked really rough. Back home, gonna do a little bit of cleaning and then work out. Much better. Today is my first day of cardiology, but I have a hot second to share with you about my experience on trauma. I think the most important thing I learned is what makes a person a good doctor. You know, there is things like having medical knowledge and knowing what's gonna kill a person, but there's also just having genuine care for patients. The doctors who took time to listen to the patient's complaints tended to have better outcomes. Imagine that. And just the doctors who came in early, made sure that there was good communication with the team. So having effective communication and having that EQ is just super important. And if you see someone struggling, it's really important to reach out to them and see what ways you can help them. It was hard. I saw some crazy things happen, but I think it was overall a good learning experience. I will have to do it again in residency.